Hello everyone. Today we discuss about hospital planning and design in healthcare MBA. So first of all we discuss about the guideline principles in planning or guiding principles in planning. A hospital in responsible for render an essential service in fulfilling this responsibility. Hospital planning should be guided by certain universally acknowledged principles. The principles are useful irrespective of the level of planning, that is, whether at the national level, state level, or individual hospital level. These principles were developed in the context of the American system of hospitals but have relevance and usefulness to hospital planning in India. And they are as relevant today as they were over 5 decades ago. Patient care of a high quality. Patient care of a high quality should be achieved by the hospital through adopting following measures that I mentioned right now. Provision of appropriate technical equipment and facilities necessary to support the hospital's objectives, and organizational structure that assigns responsibility approximately and requires accountability for a various functions within the institution. A continuous revenue of the adequacy of care provided by physicians, nursing staff, and paramedical personnel, and the adequacy with each it's supported by other hospital activities. Orderly planning. Orderly planning should be achieved by the hospital through the following: acceptance by the hospital administrator of primary responsibility for short and long range planning, with support and assistance from competent financial organizational functions and architectural advisors. Establishment of short and long range planning objectives with a list of priorities and target dates on which such objectives may be achieved. Perceptions or preparations of a functional program that describes the short range objectives and the facilities, equipment, and staffing necessary to achieve them. Effective community orientations. Effective community orientation should be achieved by the hospital through adopting the following measures: a governing board made up of persons who have demonstrated concerns for the community and leadership ability, policies that assure availability of services to all the people in the hospital's service area, participations of the hospital in community programs to provide preventive care, a public information program that keeps the community identified with the hospital's goals, objectives, and plans. Now, sound architectural plan. A sound architectural plan should be achieved by the hospital through the following points that I mentioned: engaging an architect experienced in hospital design and construction, selecting of a site large enough to provide for future expansion and accessibility of population, recognitions of the need of uncluttered traffic patterns within and without the hospital, for movement of hospital staff, patients, and visitors, and for efficient transportations of supplies. An architectural design that will permit efficient use of personnel and interchangeability of rooms and provide for flexibility also. Adequate attention to important concepts such as infection control and disasters planning also. Now, economic viability. Economic viability should be achieved by the hospital, a corporate organization that accepts responsibility for sound financial management in keeping with desirable quality of care, patient care objectives that are consistent with projected service demands, and availability of operating finance and adequate personnel and equipment. A planned program of expansion based solely on demonstrated community need. A specific program of finding that will assure replacement, improvement, and expansion of facilities and equipment without imposing too much cost burden on patient charges. An annual budget plan that will permit the hospital to keep pace with times. Now, medical technology and planning. Developments in medical technology are taking place so rapidly that now the use of sophisticated technology determines professional status. This diffusion of medical technology, vice versa, shortage of resources constantly play on the minds of the planners. Even in Western countries, rational planning for medical technology is an evasive subject. The workshop on problem of planning of health services in urban areas in Europe felt that rational planning is aided by a hospital hierarchy of specifications and by national review agencies which have strong links with similar agencies in other countries, and specialized coronary care units, that is CCUS, were introduced on the basis of the clinicians' opinions about the effectiveness of such units. The evidence is suggestive that the innovation had serious flaws, but once CCUS were established, there was great resistance to formal controlled trials. Some studies suggest that admission to a CCU is no better than treatment at home. However, the professional as well as popular view of these units is so entrenched that it is often difficult to plan for a proper use of these expensive facilities. Now, medical technology and planning. Development in medical technology are taken place too rapidly that now the use of the sophisticated technology determines professional status. So, in those countries which have a planned economy and a decentralized economic and social development administration, it is also very useful when there exists a political and administrative body with executive and coordinating authority over the regional services, not only in health but also in the educational, housing, welfare, and other fields. Even when these ideal conditions do not exist, it is still possible for countries to establish a regionalized health service provided a firm political decisions is taken and is backed by legislation also. Now, regionalizations of hospital service. Hospitals and other healthcare institutions have traditionally remained individualistic, individualistic entities independent of each other. On the contrary, they should be coordinated in order to make up a system of medical and healthcare which provides services on area-wise basis. Therefore, it would be ideal to plan the hospital services on area-wise basis. So, these cannot become possible without active involvement of the government apart from erstwhile USSR and Chile and Great Britain where complete regionalism or regionalizations of medical care has taken place. Few other countries have reorganized the hospital system along these lines. So, understanding the concept of regionalizations is necessary because regional planning of health facilities and hospital is something to which health planners have aspired for many years. Through its application, it is true that, or it is thought that, construction of new hospital and health centers can be tailored to the requirements of the users and that the necessary rational distributions of buildings and facilities will be obtained, enabling health services to be delivered according to a system in which different levels of competency adapted to the needs of the patterns can be distinguished. If regional planning is to become a functional or functioning reality, it should be based on a full and detailed study of the objective and functions of the health system. It will also be necessary to give a role in the planning process to representatives of the groups that receive the services. Although regionalizations of hospital services is theoretically possible to the enforced by law, it has been implemented to full in a few countries only because of several obstacles such as multiplicity of ownership, government, semi-government, private and charitable, etc. Difficulty in coordination between private and public institutions, problems of movement of personnel and staff, prestige, bureaucratic obstacles and lack of continuous effort and team approach. Therefore, introductions of the concept is a complex process, not easy to achieve. So that's the end of the video, my friends. If you like my blogs, please subscribe my channel. In the next episode, we will discuss about the General Hospital. Thanks again for watching.